What's your name and what's your role?
So my name's Soleil White and I'm a Yarra Bunabal woman from Broome, and I work at Broome Regional Aboriginal Medical Service as an Aboriginal Health Practitioner.
How do you know if someone has ARF?
We know if someone's got ARF if they present to the clinic with symptoms that we're looking for with ARF. So, that might be achy joints, a fever, past history of strep A, sore throat, skin sores, jerky movements, and we usually just follow the RHD Australia guidelines when it comes to ARF.
How do you know if someone has RHD?
We know if someone's got RHD if they've gone for an echo, so the ultrasound of their heart that shows that there's been damage to the valves. And we know that they have RHD if they've seen a cardiologist or a physician who's confirmed that they have that diagnosis.
What information do you give people with RHD?
We like to give people information when they're first diagnosed with RHD from the RHD Australia website. We like to use those resources, especially the Kimberley flip chart that we use, and it's really important that we provide the best education that's age appropriate to the patient and their families.
What things do you do for them if there are extra little things that they need?
So the extra things that we would do for our patients, especially if they're young or they're a teenager, making sure that, we're meeting them at their level, prioritizing what time that they feel comfortable to come into the clinic, or if they would like us to go do a home visit. If they need any help with pain management, where, that could be getting an iPad sorted for them, getting all the, numbing creams and the lignocaine in their bicillin, pretty much just doing whatever they feel comfortable for us to assist them with their diagnosis and their treatment.
What are the things you do for people with RHD that you don't do for anyone else?
Well, currently we've created a chronic conditions clinic on a Tuesday that is specific to people that are living with rheumatic heart disease. So that way they have a nurse and a doctor. They don't have to wait in the waiting room for too long. The nurses really know that their patients, so that the bicillins are already ready, how they preferred. We're giving them their injections to their preferred site. Just doing the extra things. If they want a cup of tea, if a kid wants some bubbles to distract them, we do whatever we can to try and make them feel comfortable.
What symptoms would they be looking for if they wanted to see if a community member had RAF or RHD?
So it's really important for people to come in for their annual health checks, and that's a way that we can identify any issues early on. So for example, the doctor or the nurse might listen to somebody's heart to hear if they can hear any murmurs, any complications in the heart. That's one of the ways that you might be able to identify rheumatic heart disease. But otherwise, the symptoms you'd look out for is, if your kid can't walk, if they're really unwell, that they've got a fever, they've got some jerky movements, and generally if they're unwell, to bring them into the clinic to get them assessed.
Soleil, what do you do for secondary prophylaxis and pain minimalisation?
As an Aboriginal health practitioner, I give secondary prophylaxis very often in my job. It's really important for me and my patient that we reduce as much pain as we can. We know that injections are going to be painful regardless, but there are some ways that I've found in my journey that have helped patients, and that's by putting numbing cream on 20 to 30 to 40 minutes before you give the injection, getting the child or teenager with an iPad with some headphones on to distract them, getting them to lay on their belly, to relax, to wiggle their toes, putting numbing with the bicillin injection, or talking to the client while you're giving the injection, pretty much what the patient would prefer. We have other ranges of the Buzzy Bee or the Smiley Scope for distractions. Putting some ice on there. There's multiple things that you can do to try and help your client. It all depends on them, really.